everyone. This is the Science-Based Species YouTube channel, and I'm here speaking with Dr. Ford Brewer. He has some great videos on YouTube, over 500 videos, right? And could you give a quick biography of yourself?
Sure.
Autobiography?
Thanks, Bobby. Excuse me. Thanks. Yeah, I started my career as an ER doc. As we were just mentioning before taping, I'd been a little bit frustrated in med school in that we tended to, way back in my time, this was over 30 years ago, we tended to just focus on what made sense logically. And the thing that kept bothering me was that a lot of things make sense logically, but still don't work. Um, so I went into, I wasn't ready to pick a specialty training at that point. And at that time, you could go into something like ER with just a rotating internship. I did a rotating internship at Charity Hospital, the Big Free in New Orleans. 8 of the 12 months were all focused in the major ER sections. Went out and did ER for a couple of years and enjoyed taking a break from medical training, but it just continued to hit me in the face. Everything that brought people into the ER was something that really should have happened much later. Whether it was a fish hook in the hand, this was the panhandle of Florida. So, a little bit of question about, why were you out drinking while you were doing your fishing? I understand the need for it, but, maybe you can be a little bit more careful.
Yeah.
To the kid that I went out on the highway to pick up, I-10, who'd been smashed by a truck who had been not paying attention to what he was doing and hit the kid on the side of the road. To multiple people coming in with heart attack and stroke, some as early as in their 20s, 30s, but the vast majority still in their 50s, and at that time even in their 40s. These things were things that, again, should not have been happening when they were happening. So I really enjoyed running a code. That's very exciting. But the problem is, in reality, you're adding, even in $1980, you're adding $20,000 to $30,000 to somebody's funeral bill usually, and not really creating a long-term sustained improvement in their life. So I made a commitment that I was going to get into preventive medicine. Johns Hopkins was the major place for that. Even though it tended to lean towards public health at that time, I'd gotten so sick of running codes on people and not making much of a difference in their life. I said, you know what, even if it makes a bureaucrat out of me, I'm still going to do it. I got there and I loved it. Hopkins was very focused on something that became the thing over the next decade or two, and that is evidence-based medicine. So in other words, not just thinking what makes logical sense, but actually go to the science and prove it. So you see that in this channel today. As you mentioned, it's very science-based. And it's clearly not a channel for everybody. There are, I think, 2 major attractions to my channel. One is that it actually shows ways that you can reverse plaque and heart attack and stroke risk. Number 2, it's for geeks, just really geeky type people, because I get into a lot of science on it.
Yeah, that's great. A lot of what I wanted to talk to you about was some of the things you brought up in your videos. In my channel, I discuss a lot about the potential treatments to cure aging and even extend lifespan, along with augmenting intelligence. And so in some of your videos, you've discussed some of the promising treatments out there, like metformin and niacin and even stem cells. And so that's one of the things I want to discuss with you about. Could you explain why people are thinking that aging might be considered a disease?
Well, if you read the basics on the TAME study, TAME is standing for Targeting Aging with Metformin, with Nir Barzilai at Einstein Medical School in New York. He's the principal investigator, but he really didn't come up with that alone. That was more of a group effort by the gerontologists, the doctors that work with old people out of the National Institute of Aging, NIA. And here's what they all agreed, and talk with your local internist, you'll hear the same thing. There are a couple of things that really drive the aging process. The major one by far being our loss of our ability to metabolize carbohydrates in a healthy way. In other words, we start developing insulin resistance, prediabetes, metabolic syndrome. So then our blood sugar starts to creep up and stay up. That causes plaque and causes inflammation, which in turn causes plaque. And plaque is what kills us. It causes heart attack, stroke, major cause of blindness, major cause of kidney disease, and major cause of dementia. So it all comes back to the original problem associated with as we age, we lose our ability to metabolize carbohydrates. So if that's the case, if there's a way to improve carbohydrate metabolism, then why wouldn't we try that? And that's exactly the thought processes that the gerontologists at the National Institutes of Aging went through and said, yeah, you know what? Why don't we do a study where we basically just put metformin in the water? Metformin is very safe. If it had been reviewed by the FDA this year instead of 30 or 40, 50 years ago, it probably would be over the counter. There's some outdated information out there, like Mayo Clinic. Last time I looked, they still had some statements about danger associated with lactic acidosis, and there have been 2 or 3 Cochrane studies right now. Are you familiar with the term Cochrane study?
Yeah.
So yeah, I thought you might be. So there have been 2 or 3 Cochrane studies which have said metformin's very safe. The other, I think the term is biguanides. The other groups in that class of medications do cause some lactic acidosis, but not really, not for metformin.
Yeah, metformin's been used for like 60 years.
Right. So the gerontologists got together and said, let's put it, you've got a great, safe, easy treatment. It's a simple pill. You take it twice a day. And on the other hand, you've got this overwhelmingly major cause of aging. Let's put those two together and just put metformin in the water. In other words, do a randomized clinical trial where you say, if you get you got a placebo and you got metformin. And once you hit 65, you start taking one or the other and you don't know which one. And then let's watch them go through the aging process. But that's where the funding for that study fell apart because of what you just said. So, funding for research always is focused on dealing with a certain disease. And their point here was, it's not a certain disease. It's not just heart attack. It's not just stroke. It's not just dementia. It's aging.
Yeah.
So it got the funding really got balled up in that whole political junk about that question of, well, we have to reclassify aging as a disease itself in order to get this funded. That actually stalled it for over a year. And I heard a few months ago that it was finally funded. I don't know who funded it. I don't know the current status on it.
Okay. And yeah, so and there's a popular graph that you showed in one of your videos also, in which a bunch of chronic diseases increase around the age of like 50, 60. Another popular reason for why people, researchers think aging should be considered a disease is because in mice, they've been able to make aging plastic. They've been able to accelerate and decelerate the aging process. And then I've heard you discuss a lot about niacin. Have you read much about niacin being involved in aging research lately?
A little bit. I mean, the major things that, for example, Sinclair looks at NMN, and some of the other things. And I have every expectation that it may also revolve around this same mechanism. Niacin is part of NAD, and NAD is a critical part of the metabolic process involving the mitochondria. It's how electrons and/or methyl groups are transferred. One of the key transfer waypoints or substrates is based on nicotinamide or niacin.
Yep. And then you also brought up a study about stem cells being involved in the aging process. Do you think you can discuss that study?
Well, there wasn't just one study. There were, gosh, I mean, I probably covered maybe 2 dozen. I didn't go that deep into stem cells, but I mean, here's the problem with stem cells. Now there's like the stem cells are us on every corner in your city, probably.
Yeah.
There is on mine, and unfortunately, it's the same problem that we have with any new area that's got a lot of promise. Everybody starts saying, "Well, this makes sense, so let's just try this."
Yeah.
So one of the studies I talked about, maybe perhaps one of the most popular studies in terms of quotes, was the one done out of it was the university. What's that beautiful town in Japan?
Uh,
Anyway, if you're able to find it, go ahead. It's
okay.
we actually visited that town when I was at Toyota a couple of times. Anyhow, what they did on that study was basically totally transform the process. Up until that point, stem cell research had to be was done with embryonic tissue for the most part. But these people were able to reverse the differentiation process of the human skin connective tissue disease. So they connective tissues. So they took samples of cells from human skin and reverted them back to pluripotent stem cells. So now all of a sudden, the major roadblock for stem cell research, which was what? Everybody was ethically up in arms about, well, you're killing babies to do this research. That was technically not usually true, or I don't think it was. I don't know how often it was true, if ever. But that whole smoke and mist was totally cleared out with this ability to say, I'm taking skin from an adult human, and that's where we're getting our stem cells.
Yeah.
The biggest problem now is, again, back to what we've referred to a couple of times. You've just got everybody doing what they think makes sense. No, the research is just in a terrible state for stem cells. Even the guys that are doing research are trying to come up with some sort of standard. What's the tissue that we use? Is it going to be enriched plasma? Well, enriched plasma probably doesn't have a lot of stem cells in it anyway. It's got more of a stem cell progenitor type of chemical in it, or biochemical in it. And well, if you're using stem cells, where did you get them? How much, what are the standards for how much you need in what you're using? So this is going to be a long time before this mess gets cleaned up. Meanwhile, people are adamant, they're excited, you know what? My grandfather I had a patient, for example, 4 patients whose father had a stroke, and they really wanted him to get fixed. And that's actually one of the ways that I learned. I often learn surprising things from patients. They said, we've heard that there's stem cell therapy for people that have had stroke. And I said, I didn't know that, but I'll start looking it up. I actually took a lot of classes in genetics at Stanford, and happened to be looking through there and found, sure enough, the Stanford genetics and neurology department had a case where they actually used, or actually a study. It was a small study, but they actually used stem cells in people that had had strokes and got some really good results.
Yeah.
That created a fire, a, 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 a brush fire of enthusiasm. So now everybody, you don't get it so much in the U.S. because of FDA regulation, but what you get is a bunch of people, and it's typical. It's exactly what these patients went to. They took their father to this person. He ran a stem cell treatment program offshore, and they took their father to it. He got no response, no help at all, but paid what, $20,000. So that's
Yeah.
that's the state of the art right
Well,
now.
I remember you reviewing a study on implanting younger mice's stem cells inside an older mice's brain in their hypothalamus. Uh,
Yeah,
and I think it extended the mouse's lifespan.
it
Uh,
did. It does. There's no question that there's huge potential for this space. The question is, how do you deal with it? I mean, people have, so for example, you've got two different ranges. You got people that are making up stuff like looking for sources for stem cells and using them to inject in people's faces to make their face younger. And what you've gotten some real messes there where people, every time they blink, they hear clicks because they're growing the wrong kind of tissue from those
yeah,
stem cells. They weren't actually as pluripotent as they thought, or they went the wrong direction. So they're growing like cartilage, so that is a mess. And that's one of the horror stories that's told about this. On the other hand, then you've got people that are very conservative, like Walter Longo, and he's doing this sort of the fasting mimicking diet. You're familiar? I'm sure you're familiar with that.
is that the intermediate fasting?
No, fasting mimicking diet is a little bit different.
Okay.
Actually, this uncovers a whole raft of stuff. But the bottom line is this: it's very similar to fasting. It was a diet that was developed to be the easy button for fasting. Since fasting is so difficult, especially for all of our generations that grew up never missing a meal.
Yeah.
So what he's done though is some great research to show that the human body actually responds very well to fasting. And after the fasting, when the human body is refeeding, one of the most critical things that happens is this: you start to get surges of your own inherent stem cells. So, for example, I mean, since the YouTube channel, my patient population has changed dramatically. Over half of my patients now come to me and have already lost over 30 pounds. They're getting their life together, and the pattern is the same except for one or two. And they stop eating carbs, so they stabilize their hunger episodes. Then they started closing that eating window, which you referred to, intermittent fasting. Most people call intermittent fasting, basically it boils down to skipping breakfast and eating 2 meals a day. So
Yeah.
instead of eating from 7 or 8 a.m. till 10 p.m., they close that window and they go and they eat 11 or 12 noon till 6 p.m. So they're not eating for about 16 hours a day. That's all great. It's a wonderful way, very popular and very effective for losing weight. However, I still struggle because I encourage these patients to go ahead and do some full-blown water fasting. And that's the reason why. Stem cells, helping them to understand that once you start getting that full-blown fasting push on your metabolic systems, something within our body pushes us to start using to get our stem cells geared up again. And again, if you're 60 years old and you've eaten 3 or 4 meals a day or more with snacks, you've never pushed your metabolism, you've never pushed your genetics, you never pushed your epigenetics to go in and find genes where we need to go back and do some of this repair. It's where our bodies have spent most of our time being overloaded with energy sources.
Okay, awesome. Could you discuss a little bit about how you reverse a lot of your carotid plaque and your coronary calcium?
Yeah.
You seem to have reversed that quite a bit.
The simple story